common symptoms of MS can be varied, because when we think about the physiology of multiple sclerosis, or MS, multiple sclerosis means multiple plaques. It doesn't describe the disease process itself, and in fact we don't really know what the disease process is. We have an understanding, but we can't actually define it. So when we think about the way we're wired physiologically, the brain is split into two sides, so the right hemisphere and the left hemisphere, they don't talk to each other much. And when people have MS plaques, or these spots of inflammation in the brain, it will be on one side or the other. So when you follow the symptoms, you can tell where a person will have symptoms of MS. So if a person has a plaque on the right side of their brain, they may have symptoms on the right side of their face or the left side of their body, because the right side of our brain controls the left side of their body. So that's common. People can have numbness, tingling, weakness on one side or the other, because the brain's divided down the middle. And quite often those symptoms will wax and wane. We call that remission and exacerbation. So people can have, usually it's an onset over a couple of days, where they can get numbness, tingling, weakness in one side or the other, and it will progressively get worse over several days, may stay for a while, and then it progressively goes away. And quite often, since MS strikes people between 20 and 40, which is during the years that they're developing their families or their careers, they're very busy and they don't have time to think about these weird numblies. So they blow it off and forget about it and go on about their day. So the symptoms can be just about anything. Usually MS is not painful. It's usually numbness, tingling, weakness. There are many cases that present as optic neuritis, and that's an inflammation in the nerve that controls the eye. So it would be behind the eye itself. And what they experience is a sense of veiling, is what they call it. So it feels like maybe saran wrap or layers of curtains are falling down in front of the vision itself. And they can have pain with that. So the hallmark for optic neuritis is a veiling or changing, decreasing vision in one eye, and eyeball pain itself. And that often will send people to the emergency department or go to their eye doctor to get evaluated. And then, of course, hopefully they come to me to get the rest of it evaluated. Individuals with MS oftentimes think that any symptom they have, whether it's numbness, tingling, weakness, or a kink in their shoulder or their arm, or anything going on, is due to the MS, when in fact people who have MS are susceptible to other disorders as well. So I think it's really important that patients have a primary provider and that they pay attention to other health issues. Frequently, patients will call us thinking that they have MS symptoms when in fact it may be something their primary provider needs to take care of. Now, having said that, some of the common things that people can develop or that they experience with MS, they may get overheated. For example, if somebody has an infection, like upper respiratory infection or a urinary tract infection, or surgery even, their body will create heat, and that heat makes individuals with MS feel worse. So whatever their MS symptoms are, they may get a flare of those symptoms. For example, if they have numbness, tingling, weakness on their right arm, they may notice as they're recovering from a surgery or an illness that they have numbness, tingling on that right arm, consistent with their MS symptoms. It's not a true flare-up of their MS, rather it's caused from heat. And in the old days, they used to diagnose MS by putting people in a tub of hot water, and they would see their symptoms would show up, consistent with what they had from prior exacerbations. In the summer here in Alaska, we don't have air conditioning, so when the temperatures hit 85 and people's apartments are really hot, we get a lot of phone calls in the clinic about, oh my gosh, my MS is worse, my MS is flaring up. And the key is to cool down. So jump in a lake, take a cold shower, keep cold water bottles in your refrigerator, and make sure you try and cool the core. So I teasingly talk to people about being like a nuclear reactor. They have to keep the core cool. So anything that can cause heat will make MS symptoms seem worse, even though it's not a real exacerbation of MS. And that would be a call to your neurologist. So in my practice, I think it's important, and I tell my patients that if you have symptoms that last more than 72 hours or more than 3 days that you can't explain, give us a call and we can help sort that out.